Let me give you a very good example. Very recently, with a car accident, a patient come into hospital. And the challenge we have initially is to say, well, this gentleman, what would be his illnesses while I need to treat his trauma? And because of the incidents, he had a concussion, so he couldn't really recount the history for me. That's when his electronic record that popped up in our hospital, because the patient has been there before, helped me in understanding what type of medication he's been. And so from there, understand what type of medical problems he is suffering from. I think the mobile technology is another wonderful activity where we can actually not only on an ergonomic point of view to work closely with the patient, but actually have the most up-to-date information. For example, the latest lab tests on the iPhone, or actually showing some X-rays on a iPad with the patient. I think those are fantastic ways to not only give more information for the patient, but actually engage the patient in that two-way dialogue. Well, both as a clinician and also working in an academic institution, I see the knowledge component of the electronic health record to be vital. I think it's exciting that we will have electronic record. I think also having a patient with the right type of record is fantastic. But similar to a bank account, it's great to be able to count how much money I have in the bank. But the ultimate part about knowing your bank account is how can you wisely spend your money. So in the same way, I think electronic health record for the individual patient is fantastic for him or her to know his own illnesses and her own illnesses to optimize the self-management. This is the next generation of individuals who, who really count on having technology available for them when they come out to practice. And so very exciting to not only identify with them what the current topography of EHR, but secondly, to work with them to actually co-create a better electronic health record system. They are the digital natives that grows up with technology. I'm the one that's actually foreign in terms of, gee, how do I use Facebook? But to be able to understand how the social media trends are going, how Web 3.0 are coming along, and they understand very well. And how do we bring the needs of electronic health record to co-create that? I think it's very exciting. We certainly have passed the tipping point of electronic health record adoption, past the tipping point of e-health in terms of telehealth and knowledge management. Is vitally exciting, not only for our current generation of individuals to participate in that, we absolutely need the next generation of health professionals. The nurses, the physicians, the pharmacists, the health professionals working together with our computer science colleagues, our engineering colleagues. And I think this area of development will continue to be very exciting. And so we need to have both generations working very closely together to actually bring the maximum effects of electronic health record to improve patient care.